We trusted them. You always trust that the water coming out of your faucet is safe. That was our first mistake. That's a resident of Flint, Michigan. Her words echo what so many people felt across a city that was once a beacon of American industry. A place built by the automobile, full of middle-class families who believed in the promise of their community. But that trust was completely shattered. In Flint, an American city was poisoned by its own government. A decision made to save money unleashed a catastrophe that continues to this day. But here's the terrifying truth. The aging, corroded pipes that failed the people of Flint aren't unique. They're buried under the streets of towns and cities all across America. The story of Flint is not just history, it's a warning, and it forces us all to ask the question, is your city next? It all started in April 2014. To cut costs while under state-appointed emergency financial management, the city switched Flint's water source. They stopped using the treated water from Lake Huron and started pumping it from the notoriously polluted Flint River. The complaints began almost immediately. The water coming from people's taps was discolored, sometimes yellow, sometimes brown. It smelled foul and tasted strange. Residents like Melissa Mays, a mother of 3, started documenting everything. They reported frightening symptoms, skin rashes that wouldn't go away, hair falling out in clumps, and constant nausea. They showed up at town halls with bottles of the murky water, begging for answers and for help. They were told over and over that the water was safe to drink and that it met all federal standards. But it didn't. The water from the Flint River was 19 times more corrosive than the water from Lake Huron. The critical mistake, the one that turned a cost-saving measure into a full-blown public health disaster, was the failure to add a simple corrosion control chemical to the water. This anti-corrosive agent would have cost about $100 a day. Without it, the acidic river water ate away at the city's aging infrastructure, dissolving the protective layer inside the old lead and iron pipes. Lead, a potent neurotoxin, began leaching into the water supply, flowing directly into the homes of nearly 100,000 people. For months, the citizens were ignored. It took a coalition of resident activists, local pastors, investigative journalists, and scientists to force the government to finally admit the truth. The tipping point came in the summer of 2015. Dr. Mona Hanna-Attisha, a local pediatrician, was tipped off by a water expert that the city wasn't using corrosion control. Driven by a gut-wrenching fear for the children she treated every day, she launched her own research. Dr. Hanna-Attisha analyzed hospital records of blood lead levels in children before and after the water switch. The results were horrifying. The percentage of children with elevated lead levels had doubled across the city, and in some neighborhoods, it had tripled. When she went public with her findings, state officials tried to discredit her, but her data was undeniable. The poison was real. There is no safe level of lead. For children, it's especially dangerous. A poison that silently attacks the brain and nervous system during their most critical years of development. The damage is irreversible. The children of Flint exposed to that water now face a lifetime of potential challenges: reduced IQ, developmental delays, learning disabilities, and behavioral problems. Researchers tracking the health of Flint's children found that by early 2024, their rate of depression was more than double the national average. But it wasn't just the children. A devastating outbreak of Legionnaire's disease, a severe form of pneumonia, swept through the county, killing at least 12 people and sickening dozens more, an event directly linked to the contaminated water. Studies also documented a horrifying 12% drop in fertility rates and a spike in fetal deaths. And the trauma lingered. A 2022 survey revealed that 1 in 4 adults in Flint showed signs of PTSD, a rate higher than that seen in some combat veterans. The crisis destroyed the city's economy, tanking home values and crippling local businesses. Even after the city switched back to Detroit's water in October 2015, the damage was done. The trust was gone. In 2025, a full decade later, many residents still refuse to drink the tap water, relying on bottled water for cooking, drinking, and bathing. The state has since completed a massive project to replace nearly 11,000 lead service lines. Yet, as one resident put it, they fixed the pipes, but they didn't fix the people. Flint wasn't an isolated incident. It was a warning shot that exposed the fragile, decaying foundation of a system we all depend on for life itself. The reality is that America is running on borrowed time, with a vast water infrastructure built for a bygone era. Nationwide, the average age of a water pipe is about 45 years, and some cast iron mains are still in service after more than a century. An estimated 9.2 million lead service lines, the same kind that poisoned Flint, are still delivering water to homes, schools, and daycares in every single state. The American Society of Civil Engineers, or ASCE, periodically grades the nation's infrastructure. In their 2025 report card, they gave America's drinking water systems a C-. Wastewater and stormwater systems got even worse grades, a D+ and a D. These aren't just letters on a page. They represent a system with general signs of deterioration and significant deficiencies. A C- is a barely passing grade for something so fundamental to our survival. How did this happen? It boils down to decades of chronic underinvestment. For generations, we deferred maintenance, patched up problems, and kicked the can down the road. Utilities, often struggling just to cover operational costs, simply didn't have the money for massive multi-billion-dollar overhauls. This created a staggering funding gap. In 2023, the EPA estimated that our nation's water infrastructure needs an unbelievable $625 billion over the next 20 years. The crisis in Flint became a blueprint for what could go wrong elsewhere. In Newark, New Jersey, a lead crisis that began in 2016 forced the city to distribute bottled water and launch a frantic, large-scale pipe replacement program. In Jackson, Mississippi, the state capital, the water system has repeatedly collapsed, leaving over 150,000 residents without running water for weeks at a time. And in cities like Chicago, Cleveland, and Providence, hundreds of thousands of lead pipes remain in the ground, a ticking time bomb of potential contamination. The federal government has started to respond. The landmark Infrastructure Investment and Jobs Act, signed in 2021, allocated an unprecedented $55 billion to upgrade America's water systems. That includes $15 billion specifically for lead pipe replacement. It's a historic and crucial first step, but even that massive number is just a down payment. The EPA estimates that completely replacing every lead pipe in the country could cost at least $45 billion. The total need is hundreds of billions more. The money is a start, but the challenge is immense. It's a slow, expensive process of mapping out where millions of hidden pipes are, digging them up street by street and replacing them. For some cities, the timeline for a full replacement stretches out for decades. And all the while, the risk remains. The story of Flint and the broader national crisis forces us to ask some uncomfortable questions. How could a modern American city be so completely failed by its leaders? More importantly, how can you be sure the water flowing from your own tap is safe? Here's the thing. You have a right to know. Every community water supplier is required by law to provide its customers with an annual water quality report, sometimes called a consumer confidence report. This document details where your water comes from and what contaminants, if any, have been found in it. You can usually find it on your local water utility's website, or you can call and ask for a copy. If you're concerned about lead, you can also have your water tested by a certified lab. Knowledge is your first line of defense. The people of Flint were told not to worry while they were being poisoned. Their experience teaches us that we can't afford to be complacent. It means we have to demand transparency. It means holding our elected officials accountable for investing in this essential infrastructure. The crisis in Flint was born from a toxic mix of systemic racism, environmental injustice, and a disastrous failure of government at every level. But at its heart, it was a failure to value the health and humanity of its people over a bottom line. While the story is one of tragedy, it's also one of incredible resilience. It was the people of Flint who fought for their children, who refused to be silenced, and who forced a nation to pay attention. Dr. Mona Hanna-Attisha, the pediatrician who became a reluctant hero, has since shifted her focus to tackling the child poverty that made Flint so vulnerable in the first place, calling it a prescription for a healthier future. This is the enduring lesson of Flint. It isn't just a story about brown water and lead pipes. It is a story about what happens when we lose trust in the very systems designed to protect us. The pipes are being replaced in Flint, but the deeper crisis of America's poisoned infrastructure is far from over. The question that stained the city of Flint still hangs over all of us. Who is looking out for our safety? And if we don't demand change, which city will be next?